Welcome to the lecture on sensory pathway and interpretation of a stimulus. In the last lecture, I spoke about the various sensations, the receptors that detect the sensations, and how impulses that are generated in the receptors are transmitted to the attached nerve. In this lecture, I shall talk about the sensory pathways that carry these impulses to the brain and how these impulses are interpreted. You may recall in my earlier lecture I had mentioned about the labeled line principle and the law of projection. These two principles will be evident from this lecture. So at the end of this lecture, you should be able to at least very briefly describe the sensory pathways and the sensory cortex. You should have some understanding of how impulses are carried from the receptors and the various nerves that are involved in the spinal cord and how it reaches the brain and how the different modalities of sensation are perceived by the brain and interpreted. All right? And also perception of sight, intensity, and duration of sensations. All right? Some of the mechanisms that might be involved. I shall start with a very brief case scenario. We have a grandmother who was walking with her granddaughter in the garden to see to her chickens. Now, whilst walking in the garden, the grandmother accidentally stepped on a sharp object, and she immediately felt a sharp pain in her left foot. She quickly withdrew her foot and sat on the grass. Her foot was bleeding, and the sharp pain had quickly eased into pain that was less sharp, but a little diffuse and dull. She wiped her foot with a clean piece of cloth she had with her, and then wrapped it around the wound. She was taken to a nearby hospital for treatment of the wound. She returned home after treatment. Now, what kind of questions would come into your mind? You would ask, what type of sensations were involved when she stepped on the sharp object? Which receptors would have been involved? How were the sensations from a foot transmitted to the brain? Why was the pain prolonged? How did she perceive the pain? Why was the pain sharp at first, and it then became a little diffuse and dull? Now, you may recall this picture that I had in my earlier lecture. As you will see, there are so many different types of receptors present in the skin. All right? So she probably has all these receptors on her foot as well. You have the free nerve endings, the Meckel's disc, the Krauss and clubs, the root hair plexus. All right? So these may not be found on the soles of the feet, but nevertheless you have the other receptors that are present. So really in this instance you will have a number of receptors involved. Of course the pain that she felt must have involved the free nerve endings because these are the ones that actually detect pain. There was a bit of, I'm sure she would have felt the touch as well, so there was some pressure, so she would have actually detected that too. All right. So these receptors might also have been involved, the Meckel's disc, the Mason's corpuscles, or the Pacinian corpuscles. All right. So these receptors would have generated some signals. All right. These receptors would have developed receptor potentials, and these receptor potentials would have been then converted to generator potentials, and from the generator potentials, of course, you'll have the action potentials that form in the attached nerves. So what happens to these signals from the receptors now? Now, all signals from the receptors are transmitted to the brain through nerves. All right, there is no other way. Okay, all signals from these receptors are transmitted to the brain through nerves. And you will realize, you would have noticed as well, and you may have perhaps heard this as you would know, that some impulses are transmitted more rapidly than others. As we all know that if an information is not sent rapidly enough, that information may be useless. So the question is, why is it some impulses are transmitted more rapidly than others? It is due to the differences in nerve fibers. I'll just talk about the nerve fibers and then we'll come back to the transmission, all right? Because as you would have read from the, remember from the scenario, she first felt sharp pain and then the pain became dull and diffuse. And this is because of the different fibers that are conducting it, all right? So we will talk about it a little later, but I'll just talk about the different nerve fibers. I think this is something that you need to know before we talk about how impulses are transmitted to the brain, all right? So the nerve fibers have conduction velocities, all right? And these conduction velocities can vary from 0.5 to 120 meters per second. In other words, there are nerves that conduct impulses at a rate of 0.5 meters per second. And yet there are some that conduct impulses at 120 meters per second. And what is the reason for these differing conduction velocities? Why is it some nerves are able to conduct faster than the others? The differences in the conduction velocity are primarily due to differences in the size or diameter of the nerve and also the presence or absence of myelin. Right? So the presence or absence of myelin and also the diameter of the nerve are the two major factors that would determine or influence the conduction velocity. Of course, there may be other factors too, but in the main, the nerve fibers that conduct impulses at the faster velocity usually are larger in diameter and they also have myelin sheath. And nerves that actually conduct the impulses at a lower speed or are poor in conducting impulses are usually thin and unmyelinated. Now, based on the presence or absence of myelin, the nerves have been classified as either A, B, or C. Of course, these are further divided according to their diameters and speed of conduction. You see in this table here, you have the various types of nerves. You have the sensory and motor nerves, which are divided into A, all right? And these are further subdivided into A alpha, and you see, you must have heard about the alpha motor neurons, all right? So they have the high conduction velocity, the fastest in fact, because they are large, they are heavily myelinated. Then you have the A beta fibers, you have the A gamma fibers, you have the A delta fibers, and these are the fibers that transmit touch, pressure, temperature, and fast pain, all right? They are not as heavily myelinated as the alpha, A alpha fibers, for example. Then you have the B fibers, and these are lightly myelinated. They are mainly the preganglionic autonomic nerve fibers, all right? And their conduction velocity, of course, it's moderate. It's not as fast as the A alpha fibers. And then you have the C fibers. These fibers are unmyelinated and they are small, all right? And these they conduct a slow pain. And some examples include the postganglionic autonomic nerve fibers as well, all right? And their conduction velocity is the slowest, all right? Sometimes the sensory fibers are also divided into 1, 2, 3, and 4, all right? So, for example, here, the fibers that conduct pain are classed as A delta fibers. So under the sensory classification, they would be classed as class 3 fibers, all right? So they conduct touch, pressure, fast, and temperature, all right? And C fibers here will be classed as 4 under the sensory classification. So these are the various different fibers, and because of the size of the fibers, the speed of conduction will vary. All right, so that's why sometimes you find the different types of pains. For example, the fast pain and the slow pain. That's because of the fibers that are conducting it. All right. Right. Now let's look at how the impulses from the receptors reach the brain. All right. Virtually all sensory information from the somatic segments of the body enter the spinal cord through the dorsal roots of the spinal nerves. So any information coming from the receptors, the afferent nerve, will carry that impulse from the receptors into the spinal cord, and it enters the spinal cord through the dorsal root. Upon entering the cord, all right, so what happens to this nerve? All right, the sensory impulses are transmitted through either the dorsal column, the dorsal medial lemniscal system. This is from receptors for fine touch, proprioception, and vibration. All right. So impulses from these receptors will enter the dorsal column, and then they are transmitted. They enter the dorsal roots of the spinal nerve, of the spinal cord, and are then transmitted along the dorsal medial lemniscal system. All right. So the receptors that detect fine touch, proprioception, and vibration. So impulses from these receptors are transmitted through the dorsal column medial lemniscal system. The other system that carries information from the receptors is the enterolateral system. All right. This system carries impulses from pain receptors, crude touch, thermal, pressure, tickle, itch, sexual sensations. These are transmitted through the enterolateral system. We will look at these systems in more detail shortly. But I just want to show you a picture of the various sensations just for you. All right. So you have the crude touch. All right. You have the fine touch. And you have vibration sense and proprioception. So these are some of the things that you would also do clinically. So if you want to test for crude touch, fine touch, because these are important things. These will tell you something about the status of the nervous system, see how the nervous system is functioning. All right? So these are common clinical examination tests that you would perform on patients. So as you would have noticed, just a recap, for example, pain. The tool used was pin. Right? And what are the receptors involved? These are the free nerve endings. And how are impulses from these receptors transmitted? They are usually carried by the enterolateral system, that is the lateral spinothalamic tract. All right? Crude touch, all right, that's cotton wool. Again, free nerve endings are involved and hair and organs are involved. Now, impulses from these are transmitted to the brain via the ventral spinothalamic tract, which is part of the enterolateral system. All right, so you have the lateral spinothalamic tract and you have the ventral spinothalamic tract. Fine touch that you would have seen, that you use a compass, a pencil, or a coin. This is detected by the Meissner's corpuscles or the Meckel's disc. All right? And impulses from these receptors are transmitted through the dorsal column. Deep pressure, all right? And the receptors that are involved here, the Pacinian corpuscles or the Ruffini endings, and impulses from these receptors are transmitted through the dorsal column. Vibration sense, for example, right? The tool that you used was a tuning fork. And the receptors that are involved here would be the Pacinian corpuscle, the Meissner's corpuscles. Again, impulses from these receptors are transmitted through the dorsal column. Proprioception, as you would have noticed, finger or a toe of the patient, you move around and you ask the patient, to state the position of the toe. Now, this involves the muscle spindle, and impulses from these are carried. They also involve the Pacinian corpuscles and Golgi tendon organs, for example, for proprioception. And impulses for proprioception are carried along the dorsal column. Okay, let's begin by looking at sensations transmitted through the dorsal column. All right, so you know, fine touch, deep pressure, vibration, proprioception, all these impulses are transmitted to the cerebral cortex via the dorsal column. Look at sensation of fine touch. Okay, so it's a highly localized touch sensation produced by application of a well-localized object to the skin, like pencil, pin, or comb. Right? Now, what happens is the impulses from the receptors are carried by the nerve. All right, so you have the nerve to the spinal cord, and it enters the spinal cord through the dorsal or the posterior root. All right, and these are large myelinated fibers. And what happens to them is they divide immediately into the medial and lateral branches. All right, so you can see that if you look at the diagram, you will see the medial branch. You can see them divided into the medial and the lateral branch. The medial branch then turns upwards into the dorsal column. So it forms part of the dorsal column, and it's the ascending tract. It will carry information to the brain. The lateral branch enters the gray matter of the cord and divides into terminals that synapse with local neurons in there. So you have the various parts there. The local neurons serve three functions here. All right. A large part gives off fibers that enter the dorsal column of the cord as well. All right. The short fibers terminate locally to elicit local spinal reflexes if need be. And the others give rise to the tracts that form the spinocerebellar tracts. All right, so this is how the information is conducted. All right, so for example, sensation of fine touch, that's conducted by the dorsal column. Impulses coming in from these receptors, as it enters the dorsal column, it divides. All right, the afferent nerve that's coming, that is the still the first order neuron or the primary neuron, divides into two. You have the medial branch and you have the lateral branch. All right? The medial branch immediately joins the dorsal column and it's carried upwards, whereas the lateral branch actually divides into many small branches, and they actually terminate on the synapse with the terminate and synapse the local neurons in the spinal cord. All right? And then, as I mentioned just now, these local neurons, they serve a number of functions. All right. And again, impulses from here, they also form the part of the dorsal column because they enter the dorsal column. And then the short fibers terminate locally to elicit local spinal reflexes. And then some of these send information through the spinocerebellar tracts to the cerebellum. So if you can see what happens here, I'm just going to repeat what I said just now. The fibers entering the dorsal columns, they pass uninterrupted into the dorsal medulla. All right, so they go in and they go all the way up to the medulla. All right, and then in the dorsal medulla, they synapse. All right, and they join the dorsal. Sorry, they synapse in the dorsal column nuclei. All right. The second order neurons then decussate. So as you can see, what happens here, that you will see the difference between these and the enterolateral tract as well. So in the dorsal column medial lemniscal pathway, impulses from the receptors are carried by the nerve. These are the fine touch, proprioception, and vibration. The nerve enters the dorsal root and then it goes up right all the way to the dorsal medulla. So here in the dorsal medulla, it synapses. So this is the first order neuron. It then synapses into the second order neuron, which then decussates, crosses over to the other side, all right, and travels all the way up to the thalamus. All right. It usually terminates in the ventral posterolateral nucleus of the thalamus. All right. This is a second order neuron. In fact, fibers from the trigeminal nerve also terminate on the ventral posteromedial nucleus of the thalamus. All right? Now, from the thalamus here, the third order neurons, all right, or the third order fibers travel to the somatic sensory area 1 in the postcentral gyrus of the cerebral cortex. So this is the pathway, this is the route. All right, remember these receptors for fine touch, proprioception, and vibration. When they generate the impulses, these impulses are carried via the dorsal column medial lemniscal pathway, or the dorsal column. And impulses enter the spinal cord. All right, the afferent nerve enters the spinal cord, and as we have learned just now, it actually divides into the medial branch, which goes upwards, that's ascending, and also the lateral branch, which goes into the various segments of the spinal cord. All right, and from here, of course, some of them will also join the dorsal column, and they will go all the way up to the medulla. All right, the nucleus of the medulla, they will synapse with the second order neuron. The second order neuron then decussates and goes all the way up to the thalamus. All right, ventral, posterior lateral nucleus of the thalamus. And from here it synapses with the third order neurons that then terminate at the primary somatosensory area of the cortex. All right, in the postcentral gyrus of the cerebral cortex. So this is a pathway. So this is how the impulses from the receptors are carried all the way. We'll talk about how these impulses are then interpreted afterwards. All right, so that is where it is actually interpreted. All right, so it's carried to that point in the primary somatosensory area of the cerebral cortex. Now the enterolateral pathway. All right, so the enterolateral pathway, of course, consists of the anterior spinothalamic tract and the lateral spinothalamic tract. All right, again, so it carries impulses or receives impulses from receptors for pain, temperature, crude touch, and pressure. All right, here you have impulses carried by the nerve from the receptors. It gets into the spinal cord again via the dorsal route. But unlike the dorsal tract, they immediately synapse with the second order neurons, and these second order neurons then decussate across, so at the same level. All right, so the impulses are transmitted. All right, what happens via the dorsal route? They enter the spinal cord, and upon entering, they immediately synapse with the second order neuron, and they cross over, or they decussate to the lateral and anterior white columns and travel upwards towards the brain, either through the lateral spinothalamic tract or the anterior spinothalamic tract. All right, so they go all the way up to the thalamus. So these are second order neuron, and then from the thalamus you have the third order neurons that then go on to the primary somatosensory cortex, all right, in the postcentral gyrus. This picture again depicts, but here it is together. It shows the differences between the two tracks. All right. So you have the fine touch, the proprioception, the vibration. This is the dorsal column. Impulses get into the spinal cord. It does not immediately synapse. The same primary neuron, or the first order neuron, goes all the way up to the medulla, and it then synapses with the second order neuron in the medulla. After that, the second order neuron decussates, crosses over, and then goes into the thalamus. All right. In the thalamus, it then synapses with the third order neuron, which then carry the impulses all the way to the somatosensory area of the brain. All right, the primary somatic sensory cortex. And you look at the spinothalamic tract or the enterolateral tract, and you will notice that this tract carries the impulses like pain, temperature, crude or coarse touch, and again it synapses, and this one enters the dorsal route, and now it synapses. So unlike the dorsal column, the impulses from the pain receptors, the temperature and coarse touch, the nerves carrying those impulses immediately synapse with the second order neuron at that point where they enter, and from there immediately at the same level the second order neurons then decussate, they cross over, and then they go up all the way to the thalamus. All right, they form the ascending column. This is the spinothalamic tract. And then from the thalamus, just like in the dorsal column, the third order neurons carry impulses to the primary somatic sensory cortex. This just very quickly again highlights the differences between the pathways. All right, so as I've already mentioned in the previous two slides, it's just a repeat, just to reinforce. All right, so when you're testing these pathways, so you have light touch, you have vibration, 2-point discrimination, you have sense position. This is transmitted by the dorsal column. All right, so the fibers here, they enter the dorsal root of the spinal cord, and they go all the way up to the medulla, and at the medulla they then decussate, and they will then travel in the second order neurons all the way up to the thalamus, and from the thalamus into the somatosensory area of the cerebral cortex. Yeah, all right. This is the enterolateral tract, and the difference again is, of course, it transmits the pain, temperature, and coarse touch sensations. All right, but unlike the dorsal column, here, as the primary nerve, the first order neurons enter the spinal cord, they immediately synapse with the second order neuron, and these second order neurons then decussate, and they go up to the thalamus, and then from the thalamus up to the somatosensory area of the brain, all right? The primary somatosensory cortex. This table just lists the differences between the posterior column, medial lemniscal ascending system. Just to repeat whatever I have been saying just now, the sensory modalities that are transmitted through these include vibration, tactile discrimination, position sense, proprioception, and all. All right. The primary afferents, they enter the spinal cord through the dorsal root, and the primary afferent fiber size, the fiber size is large. All right, group 1 and 2. All right, they enter the spinal cord medial to the zone of the lysua, and then the primary afferent fiber cause. All right, what is it? It ascends in the ipsilateral posterior funiculus. All right, there are no synapses in the spinal cord; they do not cross in the spinal cord. The primary afferent termination, they actually end in the medulla. All right, particularly the nucleus gracilis and nucleus cuneatus. All right, and then you have the secondary afferent neurons that arise from here, and these neurons then go on and they end in the thalamus. All right, and in the thalamus, of course, they will then, in particularly the ventral posterolateral nucleus of the thalamus, and then from there these will give rise to the tertiary afferent neurons, what we call the third order neurons, and these third order neurons will reach the final target, which is the primary somatosensory cortex. This just tabulates the ascending the enterolateral system or the anterolateral spinothalamic tract. All right, in this tract, of course, the modalities that it senses and transmits include the pain, thermal sensation. All right, and again they enter the dorsal root, at all spinal levels. Fibers are usually smaller. They are thinly myelinated. All right, and they form the group 3, the A delta fibers, or the unmyelinated group 4, or the C fibers. All right, and unlike the dorsal column, the fibers synapse. All right, the dorsal horn neurons. All right, and then it gives rise to the secondary neuron, which is the second order neuron, afferent neuron, and these then transmit impulses all the way right to the thalamus. Again, and they carry impulses to the ventral posterolateral nucleus of the thalamus. And from the thalamus, of course, they will then synapse with the third order neurons. These third order neurons will carry impulses to the primary somatosensory cortex. That's the final target. Okay. So the characteristics of transmission in the enterolateral pathway when you compare it to the dorsal column, generally the velocity of transmission in the fibers in the enterolateral column is 30 to 50% of that in the dorsal column. In other words, it is slightly slower. All right? And the reason being, in the enterolateral column, the fibers are mainly A delta, which is a class 3 and class 4 fibers, whereas in the dorsal column you have the class 1, class 2 fibers, right, which have a higher conduction velocity. Again, the other difference is the degree of spatial localization of signals is poorer in the enterolateral pathway. All right? And the gradation of intensities are also less accurate than that of fibers conducted via the dorsal column. And the ability to rapidly changing signals is also poor in this pathway. Right. Now that the signals have reached the somatosensory area of the brain, how do they localize the site of the sensation? How do we know where the sensation is coming from? Right. This diagram depicts that very nicely here for you. Mainly, that's what I said in my earlier talk, what we talked about the law of projection, all right, and also the labeled line principle. So you find sensation of pain will be carried by these special fibers. All right, that's a line principle. There are special pain fibers. These are the class 3 fibers, or the A delta fibers, or the C fibers. All right, class 3 and class 4 fibers will carry this pain. So these fibers are coming from the pain receptors, the free nerve endings. All right, so they will carry impulses along this nerve. So that is the labeled line principle. All right, so they are nerves that are labeled for this purpose. All right, so they will only carry that impulse. And then where they project, that's law of projection. That's how we know where the pain is or where the sensation is coming from. All right, so this is in the cerebral cortex, in the postcentral gyrus, this primary somatosensory area, where they fall in the primary somatosensory area. So as you can see in this diagram, it shows the somatosensory area 1, somatosensory area 2, and you can see where the sensations will land. If it is from the abdomen, it will be right at the lower end. If it is from the thigh, it's right at that end. All right. Very briefly, actually, what these sensations are actually they are how we detect them is shown very nicely by the sensory homunculus. All right, so you can see this is an upside down man. All right, so you see the head here and the leg is on the other side. It's upside down. So sensations from the head up, perhaps as you can see, from the eyes, from the nose, this is where they will be felt in the primary somatosensory area. Impulses from the toes, you can see where they will be felt. All right, so this is how we are able to localize and identify, this pain is coming or this sensation is coming from the foot. This sensation is coming from the arm. This sensation is coming from the leg. It's because of where it lands in the primary somatosensory area. All right. So because each part of your body is represented in that particular area. So that is how we are able to tell where the sensation is coming from. And it is through what is known as the sensory homunculus. Now the intensity and duration of sensation, of course, how do we tell the intensity and the duration? There are a number of mechanisms that have been proposed to explain these. One is, of course, we know from the earlier lecture that we learned the size of the receptor potential and the frequency action potential generated in a nerve. That's one way. That's one way we are able to tell, because the greater the pressure, for example, it will generate a larger receptor potential, and that will then, through generator potential, give rise to a higher frequency of action potential. So the frequency of action potentials that reach the somatosensory area is one way the brain is able to tell about the intensity of the sensation, for example. All right. The other mechanism that has been used to explain the intensity and duration of the sensation is the after discharge. Now, after discharge is the ability of neurons to rhythmically discharge impulses for a relatively long time after cessation of the stimulus. All right. So if they have a long duration, all right, if they have the ability to rhythmically discharge for a longer period, then of course the duration of sensation will be more prolonged. Of course, in the receptors itself, there will be a continuous stimulation. For example, after injury, you continue to feel the pain. It's because the receptors are also stimulated. All right, so they are continually stimulated. So that is the other mechanism as well that will determine the duration. And this mechanism after discharge is also one other mechanism that will determine the duration. All right, and this after discharge could result from a long-acting neurotransmitter. All right, so there is synaptic after discharge. So you may have a long-acting neurotransmitter, and that is released. Therefore, it will continuously excite the neurons, and you will continue to feel the pain for a long time. Or the other mechanism is the reverberatory or the oscillatory circuits. All right, so this is another, and this might be responsible for the prolongation or the duration of the signal. So here you have a diagram that shows that. As you can see, there is input coming here, and you have one arrow. This one fiber is conducting in the output. But sometimes what happens is along the way, this particular nerve might actually have projection that synapse with other neighboring neurons for a while, and then those neurons come back again. All right, so this is where what we call reverberation. So the same impulse that came through is reverberating, is going around the same circuit and coming out again. So this is perhaps one other mechanism. It's what they call the parallel after discharge circuit. This is one other mechanism that has been used to explain the prolongation or the duration of the sensation. Now, because it's going through the same fiber, and again, if the frequency of action potentials is altered here, then you might also get the higher intensity as well. But in the main, this particular circuit is used to explain the duration of the pain signal, for example. All right. So the longer the pain signal, it might be because of the duration of this reverberation within these oscillatory circuits. All right. Right, so this is all I have for you in this lecture. So what I had hoped to do in this lecture was to just highlight how the sensations that you learned about in my earlier lecture, sensations from the receptors, from the various different receptors, these sensations are then transmitted by the special nerves that are attached to these receptors. All right, and these nerves and how they enter the spinal cord. All right, and then they are mainly carried through two ascending routes, and one is the dorsal column and the other is the enterolateral column, also the spinothalamic tracts. All right, so the sensations like fine touch, proprioception, and vibration are carried by the dorsal column, medial lemniscal system, and sensations like pain, crude touch, thermal or temperature, pressure, tickle, itch, sexual sensations, these are transmitted via the enterolateral pathway or the spinothalamic tract. And how these pathways, you know that the dorsal route actually only decussates the fibers, the afferent fibers, synapse with the secondary fibers in the medulla, and that is why it decussates. Whereas in the spinothalamic tract or the enterolateral column, the fibers, the afferent fibers, the primary fibers, they will immediately synapse with the second order neuron at the same level of entry into the spinal cord, and immediately these second order neurons then decussate across to the other side, and they are carried up to the primary somatosensory area. All right, and then when they reach the primary somatosensory area, these impulses are then interpreted, and of course these are according to the law of projection, where they project onto the primary somatosensory area. So each area in the primary somatosensory area has been identified as a certain region of our body. All right, so this is where it will be interpreted. All right, okay, so I'll stop here now, and thank you very much for your attention.